Whether children are adopted internationally, domestically, or through foster care, all are at increased risk of having short and long-term medical conditions. Adoption and foster care, taking off the rose-colored glasses. Tonight, On Call with the Prairie Doc.
Welcome to On Call with the Prairie Doc. Health information based on science, built on trust. I'm tonight's Prairie Doc host, Dr. Deborah Johnston. And tonight we're going to be talking about the unique issues facing those that are adopted or who've been through foster care. Children who are adopted or placed in foster care often face special challenges. These needs can range from physical health issues to mental health concerns and developmental challenges, and require specialized care and attention. It's crucial for families who are adopting or fostering these children to have access to medical professionals who are experienced in working with this population. This support can help address any underlying issues and ensure that the children receive the necessary treatment and services to thrive in their new environment. Many families may feel overwhelmed or unsure of how to navigate the system and access the necessary resources for their child. Access to trusted support can help reduce stress and anxiety for families and create a more stable and nurturing environment for the child. Addressing the complex needs of children in foster care or those who are adopted requires a comprehensive and collaborative approach. By working together with professionals such as doctors, social workers, occupational therapists, families can ensure that children receive the care and support they need to thrive. Tonight's discussion will talk through some of these issues and answer viewer questions. This evening, we are joined in the studio by Dr. Brooke Jones, sorry, Dr. Jones, from Child's Voice, a nationally accredited children's advocacy center with Sanford in Sioux Falls, South Dakota, and Nikki Eining, a pediatric mental care access coordinator, that's quite a mouthful, Nikki, for the South Dakota Center for Disabilities, and a licensed social worker from Brookings, South Dakota. Thank you both so much for joining us tonight. This is going to be such an important discussion, and I'm just thrilled to have the two of you here with us. Dr. Jones, before we get started with our conversation, tell us a little bit about your background and what drew you to this particular field.
Sure. So I am a child abuse pediatrician, and so I did my training I'm from Kansas originally, from the University of Kansas, and then all of my pediatric and child abuse pediatric training at the University of Louisville. But my connection to South Dakota was I went to Augie for undergrad. So when I was done, they recruited me to come back because there was an opening. And so I've been here ever since finishing training. I am board certified in both pediatrics and child abuse pediatrics. And my main practice is at a child advocacy center in Sioux Falls. So I really just evaluate children when there's concerns for maltreatment.
So your practice is primarily related to those concerns and not so much a primary care practice anymore?
Yes, I'm very much just evaluating children when there's concerns for any types of maltreatment. So that could be physical abuse, sexual abuse, neglect, witness to violence, drug endangerment. And so I receive the majority of my referrals from child protection and law enforcement, but I also work with medical providers too. And then I do consultative services in our Children's Castle in Sioux Falls for children who are admitted and have concerns for child abuse and neglect.
Mm-hmm. It's a very high stress time for a lot of families too.
Yeah.
So.
And what kind of drew me to this is I love children, and I love to be an advocate for children. And so not only do we get to do the medical evaluations and be a support person for those children during those evaluations, but I can use my expertise to also advocate for them outside of the medical setting. So I can go to court and advocate for them during a court process, but I can also help with changing are helping with legislation related to children's needs, and community education. And so I'm just passionate about the work and being able to kind of help children in any way that I can.
Wonderful. Nikki, tell us about you and what drew you to this particular aspect of social work.
Yeah, so just like Dr. Jones, I'm really passionate about advocacy and prevention. I started my career in child protection services, and that did not last very long because I saw quickly, just how many youth and families were impacted by trauma, and really wanted to get more on the prevention and intervention side of things. And just thankfully fell into social work and spent kind of the last 18 years of my career really working with youth and families who've been impacted by trauma.
Wonderful. Such a valuable, important field. So, before we start our conversation, we invite you, our audience, to submit your questions for tonight's discussion about the challenges faced by those involved in adoption and foster care. Viewers can contact us 3 ways. Call 1-888-376-6225, send an email to ask@prairiedoc.org, or ask on our Prairie Doc Facebook page. We will work to answer as many of your questions as possible given the time available. Sometimes we receive more questions than we can cover, and we apologize if we don't get to your question. No information is saved and your question will remain anonymous, but viewers can leave their name, email, or phone number to be entered into a drawing for our Prairie Doc publication, Perspectives on the Prairie, but it is not required to submit a question. The winner will be drawn and announced at the end of this program. So, let's start this important conversation, ladies. So we've got some questions that had come in already, so we will look at this. Let's kind of start with some general things. What are some potential complications of abuse and neglect and childhood trauma?
Yeah, so abuse and neglect, if we don't have early intervention, can have long-term effects on the child. What happens in childhood matters, and so increasing adversity in childhood can have long-term effects, whether that be heart disease, mental health concerns, substance abuse issues, chronic obstructive pulmonary disease. It increases your risk for some long-term health management as an adult. But what we know with children, though, is that children are also resilient. And so just because something bad happened to them in childhood, there are protective factors. And so we look at positive childhood experiences and having supportive caregivers or adults or family or friends that are there actually builds resilience in adult too. And so even though there can be long-term issues, really we know that kids are resilient and can overcome some adversity as well.
So it's not destiny that they're going to have these issues because of what they went through as a child. It just increases their risk, and we need to work on bolstering those protective factors.
Absolutely.
Yeah, and we talk a lot about our nervous system and really learning about our nervous system because of that. And so when we think about the impacts of trauma, so I'm taking information in my sensory organs around me. And my nervous system takes that information in and sends it to my brain, and my brain learns to make really quick decisions. If those experiences, if that information is dangerous, if it's harmful, if it's perceived as unsafe, that's the other thing we talk about is perception. What I might deem as unsafe might not be perceived as unsafe to somebody else, but my nervous system is taking that information in as dangerous. Our body is only made to withstand stress for 20 minutes. So post those 20 minutes, I'm starting to release chemicals into my body that can have some of those long-term effects as we talk about health. But the amazing thing about our nervous system, about our brain, is we can look at rewiring. And so there are a lot of things that can buffer the impacts of childhood maltreatment. But it's really about how do we just learn more about our nervous system, because it's such a complex part of our biology that people don't really understand. We don't understand all of that because then the more we learn how to rewire some of those things and help ourselves with some of that toxic stress response.
The more we recognize the origins of our emotional responses, our physical responses.
Yeah.
So, yeah. Brooke, you had mentioned when we were talking to the students earlier, epigenetics and the impact that can have. Can you go into that a little bit for our viewers?
Sure. So chronic stress or trauma can have changes in your DNA, and so we can say epigenetic changes. And so trauma can actually be passed down through generations, and we can see intergenerational trauma because it's that change in that DNA. And so we do know that trauma and stress can affect not only yourself but long term as well.
It's amazing how our bodies are designed to survive danger, and part of that survival skill is adaptation. And so when we talk about that nervous system adaptation, we as parents want to pass that down, those adaptations. And so we see those protein changes in DNA that what the research tells us is, can live up to 3 generational turns can be impacted. So our nervous system's such an amazing thing, but it's very complex to understand.
Mm-hmm. So Grandpa, who lived through starvation in the Great Depression, those experiences that he had continue to affect me as an adult and a child. And so I think that's really important for people to recognize that we all have a vulnerability to that.
Yeah. And we think about South Dakota and natural disasters. We think about flooding, or if I've lost my shelter. When we think about the derecho, a lot of traumatic impacts. Abuse, neglect, and other household things that we can see with parents, but also some of those really chronic stressors associated with global pandemics, natural disasters, violent crimes in our neighborhood or our communities. Those things have those types of impact to our nervous system as well.
So it's something that really everybody can experience, and not just the children that have, and the adults who were children at one point in adoption or foster situations. So there is a concept out there, ACEs. Do one of you want to talk a little bit about ACEs?
Do you want to start, or do you
Sure.
want me to?
So ACEs are adverse childhood experiences, which you might hear as childhood maltreatment or traumatic experiences. You can hear many terminologies for those. So ACEs have been studied from the CDC in the early 90s. They're kind of the longitudinal study are 10 ACEs that have been studied. So have I experienced a parent who's been incarcerated? Have I experienced parental separation? Have I been a witness to domestic violence, specifically towards a mother? Have I experienced a parent with a mental illness or an addiction issue? Any type of physical abuse, sexual abuse, emotional neglect, physical neglect. So those are really those 10 adverse childhood experiences that have been studied. And what they studied was really looking at some of the health risks. They were, so Dr. Filiti and Dr. Anda were kind of exploring actually adult woman obesity and really looking at what's kind of the common thread, what's kind of the common factor. And ironically enough, a lot of the studies showed that common thread was a history of childhood maltreatment. And so really diving into that nervous system adaptation and what does that mean for our overall health, and how do we really look at understanding that nervous system piece, because just like Dr. Jones said, resilience or the rewiring of our neurobiology is completely something that can happen. And there are big pieces that we can, as communities, as systems, can walk alongside individuals to help with those resiliency components.
And when they did that original study, Fileti and Anda, they were working in that obesity clinic, and they would have patients who would lose the weight but then gain it back really quickly. And so that made them think, well, what's going on here that that is causing them to not be able to sustain this weight loss? And so looking into those other factors, and some of the women would be like, I was sexually abused as a child, and so I gained the weight as a protective factor. When I lost the weight, I started to get hit on by other individuals, and that made me feel very uncomfortable, and so I gained the weight back. And so looking at what could it be affecting your long-term health could be stemming back from your own history of trauma.
And subsequent research kind of expanded those ACEs beyond those individual factors. Can you, Dr. Jones, talk a little bit about that?
Yeah, so there's been lots of different studies looking at ACEs. Community violence is included. Anything really bad or stressful in childhood that you can think about could be considered an adverse childhood experience. So yes, that original study had that initial 10, but we know that childhood adversity isn't limited to those
things. Yeah. And I think that's a really important thing to recognize in our culture as we see school shootings and all of those things that young people today, the pandemic and the social isolation and everything else that they encounter. So, yeah, good. So what kinds of things can we do as a society, as a larger culture, to help buffer people that have gone through those?
Yeah, I think, particularly with children, having emotional support, having a protective person in their life really can change the trajectory for that child. And so being empathetic with people, understanding that trauma could be influencing behavior, it could be influencing how they even talk to people. And so always having that trauma lens when you're talking with individuals, but being that supportive person too, meeting people where they're at as a society is important.
A child is not necessarily trying to be naughty.
Right.
Yeah.
We have to think of what is causing that behavior, and a lot of times it's out of that child's control.
Yeah, we really advocate for shifting, kind of that perception of what's wrong with you to what happened that's making this experience or this situation right now really uncomfortable or seem dangerous or unsafe. And I think that's hard for all of us to grasp because, again, we have different perceptions. We bring different experiences to the table. So if I'm in a school setting, if I'm in a classroom and, I have, my aromatherapy going and the lights are dim and I have these soft sounds playing, like that's relaxing and that's soothing for me, that might be very triggering for other individuals based off of their experience of what they took in sensory wise, if that triggers their nervous system. And that's a big shift for us, really understanding that two things can be true at the same time. And that's true when we talk about all of our different perceptions, because we all experience different things that we're bringing to our relationships, to our interactions with others.
It's an important thing for us to remember, and I think especially when we're talking about children who don't have the ability to intellectualize their reactions to things, so we have to do that for them.
Yep.
Yeah, very good. So we've talked a little bit, okay. They'd like us to talk about some of the lifelong issues for mental health-wise that affect people who've had those adverse childhood experiences, adoption, foster care. What kinds of things from a mental health perspective do we see?
I'll let Nikki take that, but first just kind of talking about the adverse childhood experiences. That doesn't define people. You can have multiple adverse childhood experiences, but if you have those protective factors, you can build that resiliency and not have long-term issues. And so addressing kind of those needs early on is important, and having those protective factors. But children still can face challenges if they've experienced adversity, and so I'll kind of have.
And so when we talk about some of those protective factors, when we think about like building skills or capabilities, and so one of the things that I really like to bring awareness to is none of us are taught emotional intelligence skills. Mm-hmm. And so when we think about the complexities around trauma, especially childhood trauma, carrying around secrets or not understanding what happened, or just not understanding the sensations that I'm experiencing because of that nervous system adaptation. We don't have words or labels or things to put language to it, and so it feels completely out of our control when already so much has happened that's out of our control. And so when we talk about building skills and capabilities, I love really normalizing, since all of us have mental health development, how do we truly build emotional intelligence skills and normalize that if I'm having uncomfortable sensations, that's kind of a body clue or like a aha for me of something's going on. You know, my I've taken in sensory information, I'm uncomfortable, that's my nervous system trying to tell me something's going on. That's a clue for me. And that next step, so again, these multi-step skills, which are hard, of really truly understanding the outcome of if I attune to it. So if I attune to this, what does that mean? Well, maybe I can feel a little bit more in control. Maybe I can choose a skill to help me kind of regulate or manage my nervous system right now. But it's very often that we avoid, or maybe we deflect, or we distract, or we do those things not as like a conscious choice, but as a way to survive, as a way to try to get through that uncomfortable sensation. And so when we just talk about normalizing and trying to be more aware and curious about when those aha or triggers, or I like to use the term body clues, when they're there, like, oh, I have really high energy, that's a clue for me, something's going on inside internally. Or I'm really uncomfortable right now, that's an internal clue, something's going on, how do I check in, how do I really try to process this? Multi-step skills like that are hard, they need to be practiced, and we don't really have a set place where anybody's teaching us how to practice those.
Yeah, or people who are able to teach us to do those. Yeah. So very important information. For those who are in the foster care or adoption system, there are several challenges that caretakers and the individuals face. Prairie Doc spoke with two individuals who shed light on the reality of adoption and foster care.
Megan Johnston, who was adopted at 2 years old, speaks about the hardships she has experienced.
Unlike most trauma, adoptees are faced with a challenge others don't, which is the expectations and that they should be grateful that they were adopted.
Johnston explains that oftentimes individuals think adoption is a great thing done out of love. Even in those circumstances, it doesn't take away the pain or trauma that child may have endured.
As someone who was adopted internationally, I have faced a lot of identity crises, a lot of trouble fitting in, and a whole onslaught of different negative emotions that have all stemmed from the abandonment.
Nikki Eining is a statewide pediatric mental health care access program coordinator for the University of South Dakota Center for Disabilities. As a licensed social worker, she states that one misconception is when a child is adopted as an infant that no trauma has occurred. Eining says when working with parents and caregivers of adoptees, she works to bring awareness to adverse child experiences, also known as ACEs.
So in that ACEs research that has started with the CDC in the early 90s, separation from a biological parent is considered an adverse childhood experience.
Eining explained, even though children are grateful to be in a safe and loving home with caregivers, it is normal for them to feel sad, confused, and angry about their adoption.
Even if they're placed in a nurturing home with no toxicity, there will still be a lot of trauma in that child. And if the parent doesn't understand and is able to accommodate for that, then it'll just result in more difficulties for the child.
Eining and Johnston say being aware and educating yourself about adoption can make a difference.
As adults, it's really just trying to educate ourselves of what happens to our nervous system if we've experienced trauma.
Before my mom adopted my brother and I, she did a lot of research about relinquishment trauma, international adoption and all of that, just so she could at least have a slight understanding of what I might face as I age. I think being aware that there is a lot of pain in adoption and that adoptees will still face lots of challenges no matter how much love you give them.
Megan's actually been asking me to do this show for 3 years. She thought it was really important for people to see the other side and to think a little bit more deeply about adoption and foster care, and I agree with her. So I'm very proud of her.
Yeah.
Yes.
She did a great job.
Yes. Well, I think so. I think she's pretty special.
Yeah.
So we've had some more questions come in, and one individual wants to know where they can learn more about these ACEs.
Yeah, so the CDC has a great ACE website. So if you go to the CDC website and then type in ACE in the search, then you can find it. I think the original ACE study is on public domain. So if you Google it, you could probably get access to the article. There's been lots of books that have been written about ACEs. Dr. Nadine Burke-Harris has written a lot of books out of California about ACEs. So there's tons of information out there. A lot of it is accessible to the public.
Yeah, ACEs Aware is a great website. It's a wonderful organization that is founded to increase awareness about ACEs. And then, yep, the CDC has wonderful videos, resources, free educational series. So it's a great resource also.
Yeah. We do also do community education too about ACEs. And so we do different programming throughout the state as well.
Yep, and that can be, if you go to the South Dakota Center for Prevention and Child Maltreatment website, anybody can request a ACEs education on their website.
That's fantastic. I did not know that. I love it. Great. Here is an individual who is wondering about the effects of fetal alcohol exposure for the child and the impact on other siblings or family members. Nikki?
I will preface that is not my specialty, but when we talk about fetal alcohol syndrome disorder, we talk a lot about just impulsivity, some of that, just brain development. We can see, brains develop differently when we talk about in utero exposure to alcohol. So again, a lot of those executive functioning difficulties that are common. And so when we talk about what that means for relationships, if I am an impulsive individual who struggles with that executive functioning, so I can't think through steps, I'm really struggling with problem solving, right? I'm dysregulated often. Of course, that can disrupt our relationships. And so it really is, how do we, if we know there's confirmed exposure, how do we look at truly assessing? Because I think sometimes when we are aware, we have those conversations, right? It shifts our perspective. Really trying to be cognizant and aware, like this child isn't just choosing this reaction. If we know there are executive functioning difficulties, what does that mean? How do we understand that more? How can we support that child and, just have a different perception in that relationship and experience?
There was a related question, I think, that's important. Are we done talking about this when someone ages out of the pediatrician's office? Is it done affecting them?
No, this is a lifelong conversation. Like we talked about with that ACEs study too, it can have long-lasting effects on an individual and increased risk for certain diseases. However, everyone is different on their trauma or healing journey from their trauma. And so just because you're no longer a child doesn't mean what happened in your childhood isn't still affecting you as an adult. And so it can affect your relationships, it can affect your risk-taking behaviors about substance abuse, mental health issues. And so really continuing to have that lifelong support with their trauma journey. Also, individuals might not even disclose something that's happened to them until they're an adult anyways, or never in their lifetime. And so always having a trauma lens when we're dealing with patients is important, because we don't know where they're at on their journey of healing.
The other thing I really try to normalize is all of us have different portions of our life where it's normal that we reflect. Right. So when we talk about adolescence, I loved listening to your daughter. I'm so glad she encouraged us to be here tonight, because adolescence, it's a normal life developmental period where we explore our identity. Mm-hmm. So when we reflect and we are exploring our identity and who we are, it's normal for those thoughts, different thoughts or beliefs about our adoption, our trauma, our foster care system experience, whatever our story might be. It's normal for us to reflect on that during that developmental period. When we look at becoming a parent, that is a normal time where we reflect, like, how was I parented? Oh my goodness, I'm gonna have a child. Sometimes I hear from parents, well, what if I'm like my parent? Mm-hmm. And really, again, that normalcy of exploring in these different life portions of our life journey, it pops up for us. We might not have thought about certain things for years, and then all of a sudden, we're like, wow, where did that come from? And just trying to normalize that's normal for all of us who have experienced trauma.
So does it matter if a child is a newborn and placed with an adoptive family, removed from a home because of abuse or neglect as an infant or a toddler? Does that make a difference in terms of their trauma that they experience and the things that they may face going forward?
No, because even looking at infancy, we have such growth potential in that first year of life, and so you're developing your neural synapses, you're developing your emotional skills, your attachment skills, and so even if it's an infant taken in early on into care, their previous experiences can affect kind of those long-term skills as well. So it's really important when children are adopted or go into the foster care system that they're having those regular well-child examinations, because we need to identify any issues like with development and have early intervention for those children as well. But just, you might have different responses if a child's taken in with infancy versus different challenges if a child is adopted when they're a teenager or a school-age kid. But what happened to that child still can have effects even if they're early on in age.
And so we really talk a lot about, those pieces that buffer then. And so when we think about not only building skills and capabilities, but when we think about identity and just this normal, exploration as youth learn about who they are and that inner belief system that they're creating, how are we really building this sense of belonging? How are we really helping shape some of that inner belief of, like, I'm worthy of love, I'm worthy of safety, I'm worthy of positive relationships or safe relationships? How do we support, I think a lot about culture. That's a big one that we explore here in South Dakota. So sometimes when we talk about adoption or foster care, how are we really supporting, avenues for individuals to explore their culture and their spirituality? Because that's part of their identity, and it's normal for them to be curious about that as they grow older, and they want to learn. They will always have questions. Even as we become adults, if we haven't really explored more of that, it's normal for us to have those questions. along the way.
Look at how popular genealogy is. I mean, if, as a pastime, as a passion for people, how can we possibly think that an adoptee isn't going to have the same questions?
Right,
It
exactly.
never makes any sense that they wouldn't be
And
fascinated.
trying to, how do we normalize that? Because that doesn't mean as a caregiver, I'm not good enough. And I think that's really a thing as, you know, as society, as communities, how can we support that? Because you're right, industries have made a business out of
And a fortune.
Yes. And so we are curious where we've come from. We're curious who we are. And so how do we just normalize that? And that has nothing to do with how my parents parented me. It's just my normal curiosity.
So I think that's also a normal part of the adoption process too. You're going to have those cultural identity questions when children get older as well. And so supporting curiosity in that, exploring their thirst of knowledge for their cultural identity, and then also, you know, adapting to your cultural identity to kind of be inclusive of their previous cultural identity.
And culture doesn't necessarily mean like the obvious of my daughter from China adopted into an Italian-American family. Your culture and my culture may be different. Right. And so even though it superficially seems the same, there's still differences in our cultures, and it's important to recognize that. What started as a foster journey for a Clear Lake family continued in the adoption of 2 children. Roger Cutshaw and Leslie Larson Cutshaw share their insight on what the process looked like for their family.
Growing up, I actually had a foster brother living in our home, and I think that was something that was kind of in my heart as I grew into an adult and kind of had that idea, like I wouldn't, you know, when we got married, maybe we could foster someday and adopt.
Larson Cutshaw said after having 3 biological children, the couple revisited the idea of fostering and began working on paperwork. They then had their 4th biological child who had health issues. So they paused on the process as they felt the timing wasn't right.
And it was actually a move to South Dakota, and 5 years after that, when our oldest daughter was just finishing her junior year, she's like, Mom and Dad, I know this has been on your heart. I know you feel called to do this. You should do it now when I'm still at home.
From there, the couple contacted the Department of Social Services to begin their foster journey.
Once the paperwork was done, I think it was less than 2 weeks, and we had our first phone call.
The call was for sisters Harley and Lily. Harley was 7 and Lily was 9 months old at the time. The family took them in as foster children, but did not know how long they were going to be staying.
All they said was that they needed placement immediately, so they called us one day and brought the girls the next.
Cutshaw explained how they were fortunate for the girls to not have any medical challenges, and the transition went smoothly considering the circumstances.
Harley, good kid, certainly though had the experiences in her life that it took time for her to, I think, adjust to us.
Right.
And, adjust to our family.
Larson Cutshaw added it is essential for foster children to receive mental health services. For them, it was an immediate need for one of their foster daughters to receive that care.
We were able to get the service I think we needed. Every child is going to have a different set of needs, be it physical and mental, and we've been thankful actually that we've been able to get the services that we've, and the support that we've needed for them.
Both stated social services were very active when it came to supporting their family once the girls were taken into foster care. Cutshaw stated at least monthly they met with social services either via phone call, Zoom, or in person. The girls were under the Cutshaw's care for around 4 months until COVID-19 hit, where they were then taken to reunite with their biological family. After 6 weeks, the couple received a call stating the reunification failed. The girls were once again under the care of the Cutshaws. From there, they began the process to adopt the girls.
I think this has been good for us. It's been important for us to do this, but this is kind of where our path is taking us right now. And hopefully there's other people out there that will be willing to step forward and become foster parents themselves.
Larson Cutshaw said this journey has been transformative for the whole family, and that each child is different and better because of the experience.
Foster parents are such heroes. They really have a important role and deserve all of our support.
Absolutely.
Yes. And they brought up a really good point that I think is also related to a question that we got, wondering about how to talk to children already in the home when you're looking to adopt or foster a child, and how can the parents, the adults in the household, support the children already there and the child coming in. Sure. Thoughts?
I think we might have different responses, so I'm excited to hear what Dr. Jones talks through. When I explore this with parents, it's always like, what's the value we want to teach? What are the values we're wanting to teach our children? And talking through some of those realities. I think, when we think about being able to offer that, sometimes it's, our children haven't experienced what other children haven't experienced. Mm-hmm. And so it's hard for them to grasp or fathom, children have gone through really horrific, dangerous, traumatic experiences because thankfully, maybe we've been able to protect our children from that. And so how do we really try to teach, the value of helping our neighbor, helping our youth in our community by providing safe shelter and a safe warm bed and, whatever the case might be. So really thinking through as parents, how do we want to approach that with our child? How do we want to explore what that value is? But then also, when we think about normalizing difficulties with adjustments, how do we try to have those open lines of communication? And I think that's no matter if it's foster care and foster care children or our own children in the home, if we're fostering, adoption, change is hard. Adjustment is difficult. There's a lot of grief. There's a lot of anxiety around that, and how do we just normalize the change and adjustment and being able to really talk openly about that and process that and work through that.
All kids have to adjust if there's a new, whether it's the birth of a baby brother or sister, big siblings have to do that. It is a challenge for any child. It just may be a little bit more of a challenge when the person coming into the home has some trauma behavior that they're going to experience. Dr. Jones, anything to add to what Nikki said there?
Yeah, I think before you're thinking about being a foster parent or adoption, having those good conversations with the children that are in your home about we're looking to support other children. What are your thoughts about that? Having a family meeting, discussing kind of what makes you excited about this, or what makes you worrisome or not like the idea. But also, once a child, like you had said, any sort of transition or change is going to be hard for any of the children in the home, but still continuing to have those good avenues of protected time with each child to make sure that they know that you're still very important to me. I still love you. Having that one-on-one time is very important with all the children in the home. They might perceive that the newer child is getting more attention or getting more time spent, and they're being left out. So having that protective time is really important.
Yeah, that's something I recommend no matter how that child comes into the family.
Exactly.
Yeah.
Yes. We have a question from a potential adoptive family who has dealt with infertility. Family members are worried about attachment issues, and how do we navigate that if it is an issue? Nikki?
Attachment is, really important. It's also, there's a lot of therapeutic modalities that can help us practice different ways to engage and nurture and structure attachment with children if we're adopting, if we're fostering. And so when we talk about like dyadic therapeutic modalities, so that would be something that like I specialize in. There's multiple different types, so parent-child interaction therapy, theraplay, and so there are resources available across the state for trained therapists who can help really just guide and support different attachment opportunities to build with that youth.
So how would I go about finding those resources?
So sometimes talking to primary care can be helpful because primary care really can understand what's maybe available locally. A lot of our healthcare systems, have different outpatient behavioral therapists that might specialize in those. 211 is a great resource that you can reach out to explore different therapists locally in your area, and then calling and asking, do you specialize in attachment therapy, or do you specialize in trauma-informed therapy? Those are always really important questions to ask as we're exploring therapists or mental health resources or any resource that we're looking possibly for our family.
And we're thinking about attachment too. We have to also think about the caregiver as well, because attachment might not be immediate for the caregiver as well, and that can be normal. And so they might have guilty feelings about, why am I not as attached to this child as I thought I was going to be. So having realistic expectations that it takes time, but attachment is something that can be worked with, and usually with time, when the child feels more secure and used to the family and feel like that's a safe place, that attachment will happen.
And grief work is important, right? So, my husband and I have experienced miscarriages. When we talk about those experiences and infertility, it's really important that the support that we deserve, and just, again, increasing our own awareness around grief, that's really important, and that can be really helpful along that journey as well. And I always encourage when I work with parents that that's okay. And it's something that all of us deserve, because, again, when we talk about loss, when we talk about trauma, no one talks about it. Especially in our Midwestern culture, we're very prideful. Yeah, we're extremely prideful. And some of my girlfriends and I talk about that all the time. All of us, it is extremely common to experience a miscarriage, unfortunately. But we don't think it's common because we don't talk about it. It is extremely common to experience trauma. 1 in 2 of us have experienced an adverse childhood experience. We do not think it's that prevalent because we do not talk about it. And so how do we just make it normal that these are things that we experience, and we deserve the support to process and heal?
And you should not feel shame about seeking help or talking about it either. We just want to have support services in place for any individual that has experienced trauma.
And I think that is an important thing, that a lot of time adoptive parents have their own trauma that they're bringing into this. And if you have not considered that and recognized that, your own trauma responses are going to make it harder for you to be the nurturing parent you want to be to that child. So very important. Here's a question about health history, and we're going to do lightning round here. How do health professionals navigate health history when an adoptee may not have any? Does that have long-term consequences, not knowing that history?
Yeah, so that certainly can be a challenge, not only for children in foster care, but adoption. You might get very limited information about a child, or no information about their past. And so there are some ways that you can figure out some things. You can check immunization status through our state queries, but if you don't know immunizations, you just start over on a catch-up schedule. Having those, if you don't have information about their previous medical history, having those routine well-child examinations is going to be very important, because if we do find something, we want to have that early intervention. But if we're not consistently going to the doctor, we're not going to catch things that are brought forward. But if you don't have information, parents or foster parents are an advocate for their child. If you're noticing something abnormal or something that worries you, that's something you need to bring up to your doctor. That can be further explored. That can relieve your fears about something if it's not a big issue, but it could be something. But we need to be able to kind of have that conversation with you and evaluate that.
And part of that too is, go ahead. Sarah.
Yeah, we've got one more question, and we're almost out of time here, ladies. This individual, this family is looking at international adoption, but the husband is worried about medical challenges associated with international adoption sometimes. Where do we start researching this, and who do we go to find resources if we do adopt a child with medical needs internationally? We've got 2 minutes. I know. So there are international adoption clinics. I know the University of Minnesota has one, and they will, and I think one of the western states, they will review files and give you some information about what you might expect from this particular situation. Depending if you have an identified special need, your primary care doctor can help put you in touch with local clinicians that might have expertise in, congenital heart disease, or that's a common one, or hepatitis B or C, or there's other hemophilia, sickle cell, those kinds of things. So start with your primary doctor is what I would say, because they can often let you know where to go to get more information if there's a particular individual you're considering.
Correct.
And so that's exactly what I was going to say earlier, is how do we try to, again, not feel that shame of if there is something going on with our child, to really openly communicate that to our primary care provider and ask, where do we go next? And sometimes, we're like, well, this is a result of me failing, and how do we really shift that narrative of, unfortunately, we can't predict everything that our child might experience, or health-wise what might happen with our child.
And that's true no matter how that child comes into your family. If your birth child, your foster child, your adoptive child. I always like to say adoption is a leap of faith into the great unknown, but it's not adoption, it's parenting.
It's parenting. Absolutely.
The toughest job in the world.
Absolutely.
Parenting. Yeah. So. The winner tonight is Brenda. A book will be sent to you shortly, and we'll be back after this.
Grab a copy of your local newspaper or read online the Prairie Doc Perspective, a weekly health and medical column. Head to prairiedoc.org to access all archived columns today.
Thank you for joining us, and thank you so much to our guests, Nikki Eining and Dr. Brooke Jones, for joining us tonight and helping us understand more about childhood trauma and how that plays into foster care and adoption. So, if you would like to see and hear more episodes of this program, please like and follow us on Facebook, Instagram, YouTube, and TikTok, or visit us at prairiedoc.org. Look for Prairie Doc Perspectives in your local newspaper and online, and listen to us on Prairie Doc Radio on South Dakota Public Broadcasting Sundays at 6 a.m. and 1 p.m. And be sure to look for the podcast of this program, Prairie Doc On Call, wherever podcasts can be found. From all of us here at On Call with the Prairie Doc, thanks for joining us for another episode of health information based on science, built on trust. Until next time, stay healthy out there, people.
Many women experience an array of symptoms as their hormones shift during the months or years leading up to menopause. Menopause is a point in time, but perimenopause is an extended transitional state. Perimenopause, next time on Call with the Prairie Doc.
Hi, my name is Joni Holm, and I serve on the Healing Words Foundation Board, the nonprofit that runs the Prairie Doc programming. Our mission is to enhance health and diminish suffering by communicating useful science-based information respectfully and compassionately. Your donation supporting Prairie Doc programming makes an extraordinary difference. Gifts of any size enhance its impact in our state and beyond. Thank you for your generosity.
Major funding for On Call with the Prairie Doc has been provided by
At Avera, our nationally recognized health system will be right here with you, with care and coverage. Hello possibility. Hello healthy. Hello life. Avera, moving health forward.
Larson Manufacturing is proud to support On Call with the Prairie Doc as it continues to open doors for important medical information. And with the ongoing support of these individuals and institutions, Brookings Health System, South Dakota Academy of Family Physicians, Ophthalmology Limited, Avera Medical Group Brookings, Avera Heart Hospital, First Bank and Trust, Dakota Allergy and Asthma, Monument Health,